All right. Welcome to Alcohol Policy Use in 2023, an update. I'm Cassandra Tourre, the Director of Public Policy for the National Alcohol Beverage Control Association. So just a quick introduction about who NABCA is, and a lot of folks may have heard of our organization, but you may not have. So I always try to kind of orient people to who we are and what we do. But our job is to support our member jurisdictions in their efforts to protect public health and safety and ensure responsible and efficient systems for beverage alcohol distribution and sales. So we were founded in 1938, which was a long time ago, it was just a few years after the federal repeal of prohibition. So we've been around for some time. Our primary membership are those control systems. So there are a number of control jurisdictions within the New England states, New Hampshire being one of them, and Maine being another. But these are states that both regulate alcohol, but also sell the product, be it at wholesale or at retail. And usually the product they're selling is spirits-based products, so liquor, but in some cases they do sell wine, and in even fewer, they do sell beer. But more often than not, it is liquor. We have a really broad base of membership. In fact, New Futures is a member of NABCA, so it's open to public health and prevention groups, of course, as allied members. We have lots of researchers who are members as well. We also have all three tiers of beverage alcohol industry who can be members. We have an international contingency cohort of folks who are members. So it is pretty broad and deep. We kind of consider ourselves sort of a big tent of membership that if anybody who touches beverage alcohol in any way, shape, or form, be it policy, prevention, or selling the product, they're welcome to be members of our organization. So we're not an advocacy organization, nor are we an industry organization. We say that because so often when someone hears our organizational name, the National Alcohol Beverage Control Association, they naturally think, oh, you must be an industry-oriented group, and that isn't who we are. But we also don't take positions on policy either. What we really strive to be is a credible resource, repository of credible information that anybody who is working around alcohol beverage can seek us out and get credible information. And I think that's why the New England PTTC has asked us to be here today to share some of our information that we were tracking related to the pandemic and consumption and policy trends. So what did we see over the course of the pandemic and continue to see? Well, we saw a pretty increasing, evolving alcohol landscape. And there were lots of headlines about this, but we all felt it in our local communities and saw it happening right before our eyes. One of the things that we saw were changes in beverage categories. So we were seeing spirits-based, low-proof, ready-to-drink cocktails in cans. That was increasing. These products they continue to attempt to get parity with beer and wine. Traditionally in this country, we have fewer regulations for beer and wine and more for spirits-based products. And in this case, that means higher taxes and sold in fewer locations, spirits-based products traditionally. But these products have similar alcohol beverage by volume content as beer, and therefore they're trying, to get that parity, as they would say, to be able to sell these products where beer and wine are sold and also have a lower tax rate. So that's a pretty big initiative happening across the country. Maybe you've heard about it. There's a study, in fact, going on right now in the state of Maine on this very topic to decide whether what to do with those types of products. And particularly if you're in a controlled jurisdiction, because they often are selling spirits-based products, it becomes a point of discussion as should these products be sold in your state stores or should they be sold in places that sell beer and wine. So take the state of Vermont, which is a controlled jurisdiction. They have opted to permit these products to be sold outside of their state system and in stores that sell beer. Contrast that with the state of Pennsylvania, where the state only in their state stores will sell these spirits-based drinks. So just a lot of policy conversations happening around this particular area. Of course, home delivery, which will be a primary focus for this presentation. We saw direct shipping of alcohol, which is where a producer or a retailer is shipping across state borders and sometimes within their own border directly to the home, to the consumer. But then we also saw For on-premise licensees, the ability to either through their own employee or through a contract third-party delivery, be able to deliver alcohol. And this took shape in manufactured sealed products. So canned cocktails might be an example, or a 6-pack of beer or a bottle of wine, but also cocktails to go, meaning those products that were just sealed kind of with temporary sealant to allow people to get that with their food order, for example. So we saw that really explode during the pandemic, and it doesn't look like that's going away. And it's not that those things weren't happening prior to the pandemic, but it really escalated what might have taken 10 to 15 years, potentially 20 years to expand the way it did. And it happened really overnight in a very short period of time, mostly through executive action, but through governors. But in some cases now it's been legislated permanently. And then finally, we saw these pandemic hardships. We saw lowering the age of servers because there have been some real challenges with getting employees. They're allowing non-traditional settings to have licenses like parks and, allowing sidewalk cafes, if you will. And having just been in New York City not that long ago, I saw these seem to be sticking around, these sort of permanent sidewalk huts, if you will, right outside restaurants. It seems like in many cases, those are here to stay as well. And so it's really, it can be challenging because we need to think about training responsibilities and requirements related to how these non-traditional settings are prepared to sell the product and permit this type of consumption. I know Montgomery County, Maryland, I live in the state of Maryland, they have used some of NABCA award monies to educate these non-traditional settings on the laws and regulations around selling the product. And of course, at the end of the day, regulators and enforcement have to make sure that they adhere and have these safeguards. So these are some huge considerations for many states as they go into sort of new territory, lowering the age for servers, for example, in Michigan to 16, and then in other cases, allowing these non-traditional settings to serve the product. So here, I just want to, there's a lot going on this slide, so just bear with me. But this is a product of our own data collection at NABCA, where we were aggressively tracking all of these policy changes during the pandemic. And we've continued to, but you can imagine it slowed down quite a bit. But day to day, hour by hour, we were trying to keep track of these changes during the pandemic. And so here, what you're seeing is specifically curbside pickup for on-premise licensees around spirits-based drinks. And you can see the color coding here in the legend. The brighter blue is that the law has been made permanent to allow curbside pickup for spirits-based drinks. The teal color, the law has passed, but it's been sunset, meaning it in 2025, or they'll mark a year, and it'll indicate that the law will expire in that year if it doesn't pass permanently. In the orange, there was no order has expired. So they had a executive order, but it's expired, and now this is no longer permitted. In red, there was no activity on this in those states. And then the yellow is it varies by locality. And in this case here, I also want to point out that the stars and the diamond shape are to indicate those difference in the spirits-based products. You have the manufacturer sealed drinks, those cocktails to go that are pre-mixed in a can and manufactured sealed, versus the drinks that are mixed on the premise and then, a variety of different sealants to make it permissible according to the rules and regulations of each state. This slide, you're looking at home delivery, and we didn't we were not distinctive here between direct shipping and home delivery through third parties. So just keep that in mind. This is sort of all encompassing, but it's home delivery of spirits-based drinks for on-premise licensees. And again, similar color coding, laws made permanent, laws sunsetting, the order expired, and there's no movement at the moment. And then it varies by locality, and similar symbols to give you a sense of sort of what's happening big picture across the country around this. And of course, when we're talking about on-premise, just so I'm not talking lingo nobody understands, I'm talking about bars and restaurants specifically when I say on-premise like locations. And thanks, shout out to my colleague, our public policy analyst, Kadar Dange, who really manages much of this data. So he just updated these for us. You're the first group to see our latest and greatest data here as of January 3rd. So this is just to summarize kind of what we talked about. For on-premise licensees for alcohol to go, bars and restaurants, we saw a 169% increase. So from 16 states that allowed alcohol to go for on-premise licensees to 43 states. And I mean, again, the maps tell you that story, but this just kind of summarizes what we saw in terms of that sheer growth that would have taken probably 20 years to establish. But in the pandemic, it exploded and happened within a year and a half to 2 years, if not less time. This, you're looking at off-premise licensees. So before the pandemic, more of these certainly were permitted to do home delivery for off-premise licensees, those pre-manufactured sealed products. About 55% of states permitted, and now we're at about almost 100%. We're at 84%. So a number of different carve-outs here in the box, but in the interest of time, I'll let you all just kind of peruse that. And certainly I know these slides will be available after the presentation, so you can get some more of those details if you're interested. But I think one that's interesting to call out here is that the curbside pickup of alcohol from off-premise retailers was also expanded in 13 states, 9 of which did so through ABC guidance without clear expiration parameters set. So it's important to understand how these changes happen, and they happen in a variety of ways. They can happen through, executive action, which we saw early on in the pandemic. Then we saw legislatures get engaged and do it through, the legislative process. But of course, we have also seen ABCs come in with their rulemaking and their ability to do rulemaking and guidance where they have adopted certain parameters as well. Of course, they have to follow what the state law is, but they often are there to make it more clear what that law's intent was. So I think it's important to highlight this survey that was done. It was sparked by the Center for Alcohol Policy. If you don't know them, I highly encourage you to get familiar with their resources. But this is a National Alcohol Regulation Sentiment Survey, and it was prepared by Newbridge Strategy back in April of 2021. And this is just one data piece that they collected, but they asked the question, voters, what do voters want to see lawmakers prioritize when they're looking to change alcohol laws? And ultimately what they found is they want public health and safety to be prioritized. And in this, the top 3 things they want focused on are reducing drunk driving, protecting public health and safety, and reducing underage drinking. Way at the bottom was lowering prices of alcohol, allowing more businesses to produce and sell the product, giving consumers more choices. And this is often what sort of permeates all of the headlines and all the conversation in policy debates and discussions. But in reality, the public has weighed in and said, we actually want public health and safety to be the priority. And so there could be a disconnect with policymakers and decision makers in your state on what the public wants to be prioritized. And certainly it's data like this that can be quite compelling. So what did we see on consumption trends? And Liz Parsons with the Center for Advancing Alcohol Science to Practice will follow me with much more detail on this, but I do want to share just a few slides on what we know to be true. And this was done, this quote is from Dr. Aaron White, who's the senior scientist at NIAAA, and he was doing a webinar for the White House on a series about mental health and the mental health crisis, and it was a direct quote, and I just couldn't believe it when he said it. I said, this is so fascinating. But he said, in the U.S., alcohol sales increased more in 2020 than any time in the prior 50 years. Now, that's pretty substantial. And alcohol sales are often a proxy for alcohol consumption. So just know that when you see sales, it's frequently used as a proxy. So just looking at kind of what we saw prior to the pandemic, sort of in the early days of the pandemic and then mid-pandemic. Between 2000 and 2016, we saw a net increase 3% in alcohol consumption and about 7.5% in binge drinking occurred in this and per decade. And this was greatest among women, Blacks, and those 50 and over. Now, early in the pandemic, we saw those alcohol sales increase 34%. So remember, alcohol sales, proxy for alcohol consumption. What's interesting about this is we know people were saying, well, people shifted just where they were drinking. They were drinking at home. They weren't going to bars and restaurants. And so how can you measure that? And essentially what this study said was that off-premise, so those liquor stores, grocery stores that remained open as essential businesses, off-premise alcohol volume needed only to rise 22% to offset pandemic-related on-premise declines. So we went far above what that offset would need to happen between the bars and restaurants closing, people shifting to purchasing at liquor stores and grocery stores. So again, helpful to unpack the story here, what happened in the pandemic. And then finally, mid-pandemic time period, which we classified March 2020 to January 2021, there was a 42-week survey found that moderate drinkers, some increased and stopped, while others increased and sustained. And I think that when you look at the drinking patterns, it's an important piece of information here. But what we saw here, and I'm just trying to minimize my screen here for a moment because I can't see the full detail here, but I want to make sure I get it right. But here we go. So frequency increased. Males, whites, middle-aged, older adults, college degree recipients, and those consistently working, and those above the poverty limit, they increased their frequency. So how many times were they drinking in the past 30 days? The intensity increased. So the intensity is how much are you drinking in that setting when you do drink? And we found that it was, in this particular study, it was males, whites, non-married, those without college degrees, and people who are 18 to 39 years old. And then finally, I just want to, this is, I think, my last slide or near to my last slide. And the takeaway here is these alcohol consumption increases are translating into increases for harms. ER visits have increased, deaths have doubled, and impaired driving progress really has stalled. And we've seen about a 14% increase from 2019 to 2020. So there's a lot of work to be done to make progress and headway. And certainly the policy environment does impact how people consume and ultimately these harms. So I just want to let you know that we have lots of resources on our website, including the COVID information you saw today. You can find that under our website at the policy and research section. So, and then of course, the next slide I think has an email address, policy@nabca.org, that you can always get access to us if you're interested in getting more information. Thanks, Kristen. With that, I'm going to pass it over to Liz.
Thank you, Cassie. Great. Thank you, Kristen. Hi, everyone. Good afternoon. My name is Liz Parsons. I'm the Associate Director for the Center for Advancing Alcohol Science to Practice, and I'm currently in Massachusetts, but New England is very near and dear to my heart as I grew up in Maine, so I'm very pleased to be with you here today. I've been working on alcohol policy-related strategies and efforts for about 14 years in Massachusetts, and I'm very excited to be working now for the Center for Advancing Alcohol Science to Practice. And we opened our virtual doors not even a year ago, I think. We are funded by the CDC, and our mission is to, what you see on the screen, build the capacity of communities to use alcohol science for healthy, safe, and equitable neighborhoods through evidence-based population-level strategies. It's really alcohol science for the community good. I'll tell you a little bit more about the services that we can provide at the end here. As Kristen mentioned, is our disclaimer for our funding. We are, as I mentioned, fully funded by the CDC. Before I go any further, I just wanted to set a baseline understanding of the definition of excessive drinking or excessive alcohol use, because we hear that a lot. But just so for your information, if you didn't know already, the CDC defines excessive alcohol use as consuming 4 or more drinks on one occasion for a woman or 5 or more drinks on one occasion for a man. It includes heavy drinking, which is 8 or more drinks per week for a woman or 15 or more for a man, and any alcohol use by pregnant women or anyone under the age of 21. All right, so some of the data that that Cassie, said that I'd be speaking about. Some of you may have seen this updated attributable death data. More than 440,000 people die from excessive alcohol use in the U.S. each year. That equates to about more than 380 deaths a day. And there was recently a new analysis conducted, and some of you may have seen this, and I can send more information when the slides go out. But an estimated 1 in 8 total deaths among U.S. adults aged 20 to 64 years old were attributable to excessive alcohol use. And that includes 1 in 5 deaths among adults aged 20 to 49 years. I just want to say that again. 1 in 5 deaths among adults aged 20 to 49 years were attributable to excessive alcohol use. So Cassie mentioned the current national trends for alcohol use, and we're seeing historic increases in consumption and sales, as she also mentioned, and some real shifts in alcohol-related deaths. Now, these numbers here that I'm sharing with you are, like I said, an analysis from 2015 to 2019, and so do not include pandemic or post-pandemic information. I just want to make a note that this information could be used as a platform for your coalitions to sort of use the news. This was a recently published analysis back in November. Maybe you could, use the news to gain greater understanding of the problem and effective solutions in your community, which I'll talk about in a second. So moving on to the next slide. 9 out of 10 people who drink excessively do not meet the diagnostic criteria of being alcohol dependent. I'd be curious to know if people have heard this before, because it's often a myth that drives both prevention efforts and policy responses. But the reality is that there are a number of adults who are drinking too much and are not alcohol dependent, but that drinking is still causing them and others to experience harms. As I mentioned, underage drinking, many coalitions focus on underage drinking prevention. 29% of U.S. high school students have reported drinking, so it's almost 3 out of 10 high school-aged youth who've used alcohol. And this chart shows all deaths from excessive drinking, so that 140,000 number. And so it's not just binge drinking, but all excessive drinking. And you can find these data for your own state by using a tool. It's on the CDC website, and maybe Cassie can put it in the chat, or I can after. There is, it's the alcohol-related death indicator tool. And if you're interested in creating a movement around alcohol prevention, it may be worth looking directly at the ARDI tool to see what types of disease and condition codes are related to alcohol in your state. So you can look for the nexus to other health and societal issues like suicide or injury, homicide, and cancer, for example. You see here on the right-hand side are the chronic conditions for alcohol attributable deaths, and on the left are acute. All right, the next slide. So we mentioned binge drinking as part of excessive drinking. It's the 4 to 5 drinks, standard drinks on one occasion for women and men. It's the most common, and also it's associated with the most harms. 42% of deaths attributed to excessive drinking are a result of binge drinking. And the next slide. So you can see the leading causes of death among young people, if you can see. It's kind of small. The leading cause of death among people aged 34 or less are mostly unintentional injuries, suicide, and homicide. And then this just shows you a picture of harms attributed to excessive drinking. Homicides, falls, motor vehicle. 47% of homicides alcohol is attributed to, 32% of falls, and 28% motor vehicle crashes. And the next slide, please. And then this just shows you the picture, 24%. That's a quarter of suicides where alcohol is a attributed factor, and 18% of firearm injuries. All right, the next slide, thank you. Another reason why we emphasize preventing excessive drinking is because alcohol contributes to harm to people other than the drinker. It's associated with physical, sexual, psychological violence, property crimes, child neglect, maltreatment, crashes involving other drivers. And as many of you know, work at underage drinking prevention, earlier age of initiation of drinking, and increased frequency among youth in the same household. Like every aspect of our systems and our communities, inequities are also present when it comes to alcohol harms. There's something called the alcohol harm paradox, where those of lower socioeconomic status experience more alcohol-related harms, despite the fact that those of higher socioeconomic status drink more on average. We're finding a clustering of alcohol outlets in Black and Latino communities. There's targeted advertising to BIPOC and LGBTQ+ communities. And women experience more severe alcohol-related harms despite drinking less than men on average. And that has something to do with the physiological differences in those sexes. And let's go to the next slide. Yeah, you did already. Thank you. Cassie mentioned recent COVID and alcohol data, increase in ER visits and impaired driving and deaths. And here are a couple more recent changes. During COVID, sales from off-premise alcohol outlets were up 30% in 2021 compared to 2018 and 2019. And this may sound familiar to many of you on the local level, as you may experience and see this in your own communities. Nearly 1 in 4 of adults reported drinking more alcohol to cope with pandemic-related stress. And Cassie, of course, mentioned the impacts on home delivery and cocktails to go. The next slide. So solutions, what works? Hopefully many of you are very familiar with these strategies, but basically alcohol policies that reduce the availability and affordability of alcohol are associated with reducing overall excessive drinking, reducing motor vehicle crashes, violence, sexually transmitted infections, and chronic disease. And this is still the most recent estimate available of the cost of excessive drinking, $249 billion, or over $2 a drink. You may have this information for your own state, but these are specifically costs related to healthcare, motor vehicle crashes, criminal legal system processes, and productivity losses. So what works? So we really look to, that slide, that looks good. Okay. We really look to the Community Preventative Services Task Force, or what we call the Community Guide. And I find this slide very difficult to look at. So if we go to the next one, we can zoom in. Thank you. You'll see a few population level strategies that, based on the evidence, can have impactful effects on excessive drinking. And those are the strategies in the green circle. So there's the top, a commercial host liability. So holding retailers responsible for selling to youth, electronic screening and brief intervention, increasing taxes, a lot of around outlet density and days and hours of sale, and of course having not privatizing alcohol sales, but having a control state, which will be a great segue to Kate's presentation in a second. The next slide, please. So just want, again, some of you may have seen this, but at the top of this pyramid are the individual approaches like counseling and expert, which would affect a smaller portion of the population as we work our way down to the bottom. Those are going to affect more and more of the population. So these are factors, obviously at the bottom are factors related to the social determinants of health, which if changed would have the largest impact. And then just above that are the evidence-based population level strategies that are related to alcohol policies. And so they all affect the environment in which we interact with alcohol. So like increasing alcohol excise taxes, reducing alcohol outlets and marketing, removing dangerous products like alcoholic energy drinks, basically alcohol and caffeine. And so those are highlighted because they're associated with the environmental context. But you also notice from this graph or from experience that these are the efforts that can take the most political will and can often take time. So in order to help, if anyone is working towards those alcohol policy goals or would like to, the center is happy to support you. We are a training and technical assistance center. And so our approach in the next slide is to build partnerships nationally with several partners to deliver TA and technical assistance. We also connect our communities with the researchers and the science behind certain policies and really help try to support the translation of effective strategies into public health practice. An example of that is that RD data that I mentioned. We have a research highlight that I will send out as well, which helps you sort of use that most recent analysis to put it to good use and provide that information for your stakeholders in your state. Kristen, I think we can fly through the next couple of slides. This is just our partnership council, our cadre of experts. These are the experts that we could get you in connection with. And you can go to the next one, please. Thank you. These are a couple of great websites if you haven't used them already. And a couple other resources if you haven't connected with the U.S. Alcohol Policy Alliance yet. There's their information. They work towards supporting statewide groups and statewide alcohol policy coalitions. And then the alcohol, tobacco, and other drugs section of the American Public Health Association is an excellent resource. And I highly recommend, if you're working on anything related to alcohol policy, to be connected with them. And of course, please reach out if you do have a TA request or any question or need to know where to find something or would like some training. Use our QR code and you'll get up-to-date information, including newly developed state reports around alcohol-related data and harms for every state. So the CDC will be releasing those soon. And if you sign up to our mailing list, we'll make sure that you get that information timely. So thank you all very much. It's my pleasure to introduce Kate Frey, who I've known for a few years. She's the Vice President of Advocacy at New Futures in New Hampshire, and what an incredible person to have on your team. So Kate, why don't you take it away?
Great. Thank you so much, Liz. And I want to thank Christian and the Center for including me in this presentation today, and my co-presenters as well. A lot of what I've learned on alcohol policy, I've learned from them. So both Kathy and Liz did a great job of spelling out what are the harms around alcohol, what are the what we saw since the pandemic, what all of these numbers mean. And what I want to talk about a little today is, when these changes are made, what does this mean for the state? What does this mean for the residents of your state? And how to take how to gather data from what is happening from the result of some policy changes, and to use it to really further the mission around health and wellness. And so I'll talk a little bit, next slide please, about our organization, New Futures. We're here in New Hampshire and New England, and we are a nonpartisan, nonprofit organization. And then we really focus on the health and wellness of all New Hampshire residents. So we support public policies that would support health and wellness. Next slide, our policy area. I will give a little bit of history. When we were first created in the late 90s through a very generous donation through our charitable foundation to focus on alcohol and other drug problems. That was the focus of our work in the late 90s. And that was really, alcohol policy was something that we really, was one of the issues we really honed in on and did a lot of work in that area, as well as access to treatment. And then our funders later said, we want you to do the same kind of policy you're working in these areas, but expand it to health, early childhood, and children's behavioral health. So you see that we work on a number of buckets, but the first two was really something that this organization has always worked on. And at that time was really, the thought behind it was you can provide all the direct services in the world, but unless you make policies change at the state level, it won't trickle down. So next slide. So we really do this in three important ways. We advocate, collaborate, and educate. So advocating, myself and a few other policy folks here are lobbyists. We look very closely at legislation that is affecting our bucket area, and our job is to be at the State House and testify based on public health evidence regarding certain policies. We would not be where we are today if we did not collaborate with the number of organizations that work on these issues as well, especially direct services. I work very closely with our prevention community in the state. So we work closely with coalitions, and even you'll learn today, even at the national level, those coalitions are so important. And then really to educate, this is where we then train advocates. Folks who are interested in making a change at the policy level, and we train them about the legislative process, kind of take the stigma out of it so it seems less scary, and encourage them to show up at the State House and testify. So the next slide, I realized I left one slide out that would have kind of tied into this more. But I think we've all heard about prohibition, and we've seen the movies, and it's important to understand that really the end of prohibition led to alcohol policy reform, and it's really the state's current alcohol regulatory structures. Ever since the 21st Amendment was put into place, it was really required that the states kind of come up with their method of how they would regulate the alcohol industry in their state. So really at that time, most states adopted a 3-tier system. You have the manufacturer, the wholesaler, and the retailer. The idea behind it is that no one party could be involved in more than one tier. Each tier was regulated independently, and that there was significant variability for each state, licensing and control state. So New Hampshire, I just want to say that we are a control state, as Cassie mentioned in the beginning. So they regulate and enforce the sales, but also at the same time, the New Hampshire Liquor Commission is responsible for the sales of spirits and wine in the state too. So it's an interesting kind of parallel sometimes, that you have the state agency who is required to sell as much spirits and wine as possible to have revenue available to the state. They're also required to enforce many of these laws too. So we work really closely with our Liquor Commission on that. I just want to make sure there's anything else. So in New Hampshire, as I said, we're a control state. We are established under the Liquor Commission. I think we can skip this. As I said, they direct the sale through their liquor stores of spirits and wine. They also collect license fees for manufacturing, the sale of transportation, warehousing of beverages, and there's also a 30-cent per gallon tax on beer. So let's just skip ahead here oh no, you can go back. I'm sorry. I'm following along with my other slides. But the 3-tier system, it's really important to understand that As I said before, the Liquor Commission is responsible for raising revenue in the state through the sale of alcohol. They had record sales of $765 million in 2021. A lot of what you heard about is that increase in alcohol sales post-pandemic, during the pandemic and post-pandemic, and that's a $36.5 million increase. The Liquor Commission, for the most part, their revenue goes to the general fund in the state. So our state really builds much of the budget with that money to support services in transportation, natural resources, and lastly, health and social services. By law, 5% of gross profits each year is supposed to go to the Alcohol Abuse Prevention and Treatment Fund. That has been a law that hasn't always been followed since its creation, but we are happy to say $10 million in 2021 was devoted to prevention, treatment, and recovery contracts in New Hampshire. So now you can go to the next slide. I'm sorry about that. So, the benefits, as I said before, really were regulatory, economic, commercial, and specifically also public health, and making sure by having these 3 tiers in place that there were sound public health regulations in place as well too. So the biggest thing that we see as a threat in the state from alcohol policy is now these blurred lines between tiers. The commerce chair in our state talks about, yeah, we want to protect the 3-tier system, but we're already trampling over it. And it's really true that that you see every legislative year there's kind of a blurring of tiers. We see weakened marketing restrictions. You're seeing increased alcohol percentages in products. As Cassie said, these canned cocktails to go, more availability and greater access to alcohol through products like that. Online sales. So these are all things that we have to look at very closely when we look at alcohol policy. Next slide. So we already heard a little bit about the pandemic and what we were seeing, what we saw directly happen from that regarding alcohol policy pretty quickly in the pandemic. And we were seeing trends that we hadn't seen before because there was this emphasis to social distance. There was more of this opportunity to kind of drink alone or drink not out in public, where there are more measures in place as far as over service. You were seeing a lot of social media about playing a bigger role in our lives, in the last 10 years, and kind of a lot of social media clips about drinking more, and this one is taken from there as well. And the deluge of hashtags promoting drinking. So there were a lot of things that came out of the pandemic really quickly. Next slide. And then, of course, right away, as Cassie said, we really saw kind of this power grab, I'll say, is, this opportunity that restaurants and bars had seen, and obviously out of a concern of lost revenue, that was very, very clear. But, what policies can be changed in order to accommodate the loss of income from restaurants and bars, but also kind of make sure that the public still has access, free access to alcohol in their state. So, skipping ahead to this, in New Hampshire, what real issue came alive very quickly in the first days of the pandemic was really this restaurant delivery of alcohol or alcohol to go. And I remember being in the State House cafeteria in January of 2020. I was meeting with the Restaurant and Lodging Association lobbyist, and he had said that they were going to introduce Senate Bill 512 relative to the transportation of beverages, basically alcohol to go. But he didn't think it would get very far, and he knew our organization wouldn't go along with it, but they were going to introduce it. And boom, COVID hit. And then the conversation changed really quickly. Like many states, we get kind of a break or a delay in our legislative session. But the sixth order that Governor Sununu in our state signed was for this authorization for takeout of delivery and beer and wine and delivery. And this was for Senate Bill 5, is the language basically from Senate Bill 512. The legislation was passed a few months later with through omnibus legislation. But the good thing is it did have at that time a sunset provision, which Cassie talked about earlier. Unfortunately, that sunset provision came out the next year. So what happens next now? So this is where the coalition at the national level really saved the day for many of us in alcohol policy in the state. A lot of the organizations Liz mentioned quickly pulled together states in a way that really formed kind of the Alcohol Action Network. And that really not only for me provided some therapy as far as I was not the only one seeing this in our state, that this was an active, grab by the industry, but then, okay, what can we do about it? And so one of the things that came out of these meetings and meeting with researchers and really smart people is a development of the alcohol assessment. So, really this meant, all right, fine. If we're changing policies, that's great, but we need to collect data to know what has been the impact. Are we seeing more access to for minors? Are we seeing kind of this abuse of this new advantage for restaurants? So we really needed to look at that. We met with the Liquor Commission in September 2021. I will have to say our Liquor Commission was really great on this bill to begin with. They right away said that they would not think about the ideas of cocktails to go. They also had a really smart way of coming up with the idea behind the legislation, and that was to have a license. And then within that license, there are very strict rules about where they can deliver. They have to obviously look at ID. They can't serve to someone who's been drinking, record keeping, things like that. However, when we talked to them about the assessment after the law was passed, there was really, I think, some hesitancy in the beginning. I think they were concerned that we were looking at this as like just, coming down with the hammer and saying, you're doing this wrong. But we really wanted to talk to them more about, no, if you want to make this change, if this change has been made, is this working? If it's not working, what changes can be made in the future? Fortunately, NABCA, at the same time, they do provide education grants to control states, and they had encouraged the use of their education grants for assessment development. Our Liquor Commission also gets education grants. They finally connected the dots and began working with us on the grant. And that grant was awarded to the Liquor Commission in May 2022. Next slide. So very high level because we're running out of time. This compliance initiative, Restaurant Delivery License Compliance Initiative, obviously it's the goal for us is to collect data that can inform decision makers on how these policies are being implemented. And the impact on access. But for the Liquor Commission, too, a large goal of that is also to collect that data, but also to offer training programs for these licensees and, maybe down the line have something that is more intuitive to licensees to help them through the process like an app. So in the process right now, I believe is the initiation phase. We've completed that. It's the development, and we haven't deployed the survey tool, but we plan to soon. A data analysis from those results and the development of a training program. Phase 2 will follow up compliance check on all restaurant delivery licensees. We learned from enforcement authorities in other states that this is really something that the compliance rate has been really low on. So we are interested in finding out the results from these compliance checks. And then finally, a final analysis of the project and then an after action planning. So this is all being performed right now. We have through the end of, or I believe May of this year to have that information. But it really, I think, to just kind of summarize this discussion is that you really want to work closely with your partners, both at the national and the state level, to talk about those next steps. instead of just walking away and saying, oh boy, we lost the alcohol industry won again. What can we do to really formulate the next policy discussion that needs to be queued up? And working with partners is really the only way you can do that. So again, thank you. And the contact information for our organization is right here. And please let me know if you have any questions.
Great. Thank you so much to all three of you. That was fantastic. We do have just a couple of short minutes here for if there are any questions. And I do want to say, I know there's been a lot of links to different resources shared in the chat. I'm going to pull all of those and I will send those out all in one document along with the slides after this. So you don't have to worry about running through the chat and saving all those links. I will compile those for you. And last but not least, while I have you all here, before you jump off, please do take a minute now to open this link, which is our evaluation survey. It's very brief, so very helpful to us if you can take a minute to complete that survey. But I did see a question there from Samantha about your thoughts on the growing trend of non-alcoholic beers and maybe how that fits into some of these other discussions.
Kate, it looked like you were going to say something, so I was going to let you take it.
Okay, I'll start and then I'll have others. And I guess I'm not going to just focus on non-alcoholic beers, but this whole idea behind Sober Curious and Dry January and all of these things, I think is a good initiative and good ideas and a way to kind of push that discussion of we don't need to have alcohol as this kind of social, support for folks. A crutch is the word I was looking for. I will say, non-alcoholic beers, sometimes I haven't looked into the issue in a long time. There was still some concern about a very small percentage of alcohol. I don't know if that's the case anymore. And sometimes it really needs someone needs to take a break from the whole idea around anything that's considered, a beer. But, I defer to others on this, but overall, I would say that I think our country is having some really good dialogue around, ways to socialize and have fun with folks without alcohol being in that equation.
I think you said it well, Kate. I don't have much more to add. Thank you.
All right.
Well, Chris, do we have any more questions? If we don't, I just want to make a plug for people to, in order to access the tool that Kate used and actually Oregon also used, the CAP tool from the Alcohol Action Network. I put the link in the chat, but so frequently we are having conversations with a void of data, and what our policymakers are hearing is it's going just perfectly well. And we don't know that unless we're out there doing compliance monitoring and we're doing data collection. So as coalitions, people who are in prevention, you have a great resource, the Alcohol Action Network, this tool. It's free. They'll even do the data analysis for you to do your own data collection so you can meaningfully engage in that conversation in your state. So if you took nothing away from this conversation, I hope you take that away from this conversation.